This morning's workshop is adapting evidence-based practices to meet your community's needs. Your presenters are Jennifer Rolls-Roots and me, Dana Jarzinka. And this morning, we're going to talk about every evidence-based practice, or EBP, is adapted in some way when implemented in real world settings. In today's workshop, we're going to focus on best practices for adapting EBPs to meet local and cultural needs. We'll discuss what EBPs and adaptations are, common reasons adaptation is needed, and best practices to guide and implement adaptations. As I noted, I'm Dana Jarzinka, and I'll be one of the two presenters for this workshop. I'm currently the administrative manager for mental, behavioral, and developmental health services at Rady Children's Hospital, San Diego, which is also where Caltrain calls home. And I'm a former Caltrain training coordinator and very happy to be back with you all this morning. I'd also like to introduce Jennifer Rolls-Roots. Jennifer is the director of both Caltrain and the California Evidence-Based Clearinghouse for Child Welfare, or CEDC. In this role, she oversees the day-to-day operations of both projects and is responsible for their delivery and overall success. I'm going to turn it over to Jennifer now to tell you a little bit more about the CEDC and outline our plan for today. Jennifer?
Great. Thanks, Dana. Thanks, everyone, for joining us. And I wanted to actually give a special thanks to Dana, since although she is a former Caltrain training coordinator, she just left us last week for a great promotion. So I'm sad to see her go, but happy to see her move on and move up. So I'm glad that she could stay with us and finish this one, and maybe we'll see her back in the future. All right, so let's get on to what you guys are here for. So first, as Dana mentioned, I'm with both Caltrain and what's called the CEDC, the California Evidence-Based Clearinghouse. And if you've ever been to the CEDC website before, why don't you go into the reaction toolbar and just drop a thumbs up or a heart or whatever you want to do. Just give me kind of a feeling of, have people actually been to the CEDC, or are we all new to this? Okay, so I'm seeing a couple things. Thank you. All right, so on the CEDC, really our mission is to help advance implementation of evidence-based practices for children and families involved in the child welfare system. But the reality is it's not just the child welfare system, it is all child and family serving systems can really benefit from the information that we provide. We started out with a program registry, which we still have. That is what most people are familiar with. And we review and rate and give detailed descriptions of all sorts of interventions for children and families. What we realized after a few years of putting the registry out was that agencies and programs needed help on the selection and implementation side. So how do you know which practice is best for what you need? Yeah, and so we created a kind of a separate section called selecting and implementing programs. And we do technical assistance in this area for agencies in California. We'll talk more about that later. But really, it's twofold. And the best example I can give of why people need help selecting the right program is that it's not a one size fits all approach. If you think about like the world of medicine, we have hundreds of different antibiotics. We have over 100 medications approved to treat high blood pressure. Why do we have so many? Well, that's because they all target different causes of the issue, plus people respond differently. So it's not that unusual in the medical world to, try one medication, not have it work correctly or work sufficiently, and then move on to something else. And so we need to start kind of thinking about that in our work as well. It's not one size fits all. Different people, different communities need different interventions. And that's where the CEDC comes in. All right, so today we're going to talk about what's an EBP, what is an adaptation, and how adaptations can affect the results that you get. We'll give some examples of EBP adaptations, and we'll introduce something called the traffic light model. We're going to practice making some adaptations. You're going to do some small group activities towards the end, and then we'll talk about alternatives to adaptations. So what do you do if you think an adaptation is needed that might be a little bit more significant? So lots to come. So let's start off with, what is an evidence-based practice? What I like to say is that it really depends on what you want to achieve. What are you trying to address? What is the outcome you're trying to get to? That helps you determine what's the appropriate evidence-based practice. Then you look at the options, the programs, all the different interventions that will help you get to that result. So on the CEBC, all of our programs are arranged in topic areas, and the topic areas are the outcome you're looking for. Are you looking to treat depression? Are you looking to prevent substance abuse? So we're really trying to get at, one program can do multiple things. It can have many different outcomes, and we review and rate the program based on those outcomes. Okay. So at the CEBC, we use this kind of 3 concentric circles model. And what we believe is that an evidence-based practice for a particular family or situation really depends on several pieces all coming together. So let's walk through what those are. The first one is the best research evidence. So clearly, most people know the CEBC just as a registry. So this is the information, the research information that the CEBC provides. What types of studies were done? What outcomes were found? Were they statistically significant? And for the CEBC, we want to look at how long the effects last. So that's the research evidence. That's that rating on the CEBC of a 1 or a 2, et cetera. That's one piece of the puzzle, because there's 2 more really important pieces when you're considering whether something is truly an evidence-based practice for your needs. Secondly is, what is meeting your local needs, the family you're working with, the community that you're implementing in? What's acceptable in this area? We're going to talk about cultural issues later on. So this is where this piece comes in. What's expected? What will work with the family that you're working with? The CEBC tries to provide some pretty detailed information about each program that will help you answer this question, of whether any individual program would fit your needs. We also provide information on the populations in which the research was conducted. So you can see, is it similar to your population or is it totally different? Try to give you information to help with this piece. And then lastly, we call this best clinical experience. As you can see from the bottom, we adopted this model from the Institute of Medicine. So it's using that kind of clinical piece. But the reality is it's from the service provider's perspective. What do you think is needed in your experience working with this community, with this population, or with this family? What do you think is going to be most appropriate to get at the issues that you're trying to address? And again, we provide information about that, about the goals, the target population, the outcomes that can help you make some of these decisions. So on the CEBC, we really say that it's not just research. It's not enough to say something is well supported by research evidence. To be truly an evidence-based practice, it also needs to fit the other ones. It has to fit your values, it has to fit the community needs, and it has to fit in your service provider clinical judgment, what you think is needed in the situation. And so we've got that little overlapping triangle in the center, and really that's what becomes an evidence-based practice. Okay. Selection. Why this becomes an issue. So again, we need to make sure that all of these things are in place, because if we don't meet all of those needs, the evidence, the community, and the provider perspective, we'll have negative consequences. And when you think about the negative consequences of adopting an EBP, these could be things as simple as, well, not as simple. These could be things like wasted money. Think about how much money you spend adopting something, implementing it. If it doesn't work because it's not the right fit, that's a waste. You're wasting time. I'm sure we've all been through initiative rollouts where you spend all this time doing something new at your agency, and then within a year or two, it kind of disappears. So again, it can be a waste of time. And then ultimately, it's really a waste for the families and the youth that we're serving, that we're not giving them what they need to achieve the most positive outcomes. So again, not one size fits all. And it's very important to be thinking about how an EBP might fit your needs, because the success and sustainability of any practice begins with choosing the right one. So one thing that the CEBC has done to try to help agencies is we've created a guide. It's publicly available on the website, and I think we're dropping a link to it. You can download this. There are worksheets. We use something called the EBPs framework to support implementation. That stands for exploration, preparation, implementation, and sustainability. So what we will do is use this to help agencies, work through the selection and implementation process. So I'll give you an example. We had an agency that was looking for a parent training program to be included in an upcoming proposal. So we worked with them. We went through the guide. We had a couple of Zoom calls with them to talk about their needs. We talked about what they were already doing, how that had gone, and what was the community? Where were they intending to implement this parent training program? They went through the CEBC and they identified a couple of models they thought had interest. They did some additional work. They talked with their stakeholders. They talked to the program developers, et cetera. And then they made a final decision about what they were going to select. So again, it's working through the steps. And as I mentioned before, the CEBC is available to help. So if you're in California, you can reach out to us. We'll give you our contact information at the end. And we're available to provide some technical assistance for free for California agencies who want some support. All right, now I'm turning this over to Dana.
So we are going to look this morning at what is adaptation. And what we are looking at is any changes to a program. This includes content, or what is delivered, and implementation, which is how a program is delivered. And so we're going to really quickly this morning look at the what of adaptation before we get to the how. And to do that, to better understand adaptation to EBPs, we're going to use a baking metaphor. And specifically, we're going to talk about cake. So if you thought that icebreaker about breakfast was rough, get ready. We've got some images for you. In the chat, tell me what you think are the most important things to consider when making a cake. What do you think? If you're going to make a cake, what's super important? Exactly. Ingredients, keep them coming. Ingredients, for sure. What else? Yes, Rhonda, time. You need the time to bake a cake. You need to know how long to bake it. Baking powder, soda, something to leaven it, keeping track of food allergies. So really thinking about who's eating your cake, actually using measuring, bakeware. Do you need stoneware? Do you need a metal pan, a glass pan? Exactly. You guys have it. The utensils, actually following a recipe. I don't know about you, but I have one of those moms who like bakes without a recipe, like she's cooking. It's not a thing. An oven that works, preference, all of those things. Exactly. So when we're baking a cake, you guys have really hit it. We are looking at core ingredients, core methods, core equipment, and variations. So we're going to look at each of those in turn, and we're going to really look at, okay, why are we using this cake metaphor for EBPs? And it's going to make sense. All right, so we're going to talk first about core ingredients. When we're looking at cake, core ingredients are those things you need or a cake isn't going to actually produce the desired outcome of the recipe. So probably flour, probably eggs, probably sugar. In our metaphor, just like flour and eggs are usually core to making a cake, there are a couple of core ingredients for an EBP. So we're talking about a theory of change, using a logic model, and then the core elements of that evidence-based practice. And so that's what we would look at when we're talking about the core ingredients of an EBP. The next thing we're going to look at is the core methods. So when we're talking about cake, you'll mention it in the chat. How are you mixing it? How long do you bake it? What temperature does this go in at? Do you have to change the temperature halfway through? Right? So those are methods. When you're looking at an EBP, it's the method of how, when, and why that program works. And that's been tested. It has an evidence base. So changing that how, when, and why could negatively impact the results. Examples are delivery methods, dosage, activities, the environment it's offered in. Those are all methods. And then finally, core equipment. So when we're talking about cake, again, you guys said it in the chat, you need to think about the type of cake tin or the type of oven you're going to use. Does this need to be beat at high speed? Those sorts of things, the equipment. With an EBP, this is a little bit more of a reach, but you're talking about things like what kind of staff training and qualifications do you need? Do you have the team for this? Do you have the agency capacity? And what are the materials required in this EBP? So it's the core equipment that you're looking at for an EBP. And then let's talk about variation. So when we're talking cake, a variation is, so these are minor tweaks. These are adding ingredients to change flavor or color. Maybe you want to do a different icing than you usually do, but you're not making major changes. On an EBP, in our metaphor, this would be things like changing images or terms in the materials, adding local resources, or making sure that the staff are culturally represented. And the reason you might do a variation is to really look at what people want and need and what is locally available. So, why are we adapting EBPs? What, tell me in the chat, what are some reasons you have found for needing to adapt your programs? And I want you to, if you're kind of having trouble thinking of, gosh, why have we adapted EBPs? If you are on page 6 of your participant workbook, we have a handy list of questions that teams should probably ask themselves to think about why they would adapt an EBP. So this is a good resource for later, but also for framing why you might have changed something in the past. So what are some reasons you found to adapt your programs? Culture, it's a big one. What specifically about culture might you be changing? So improving positive outcomes, what kinds of changes did you find necessary to change those outcomes? Change in population of focus. We're gonna talk about that a little bit as we move through this training. Interesting. Funding restrictions. Great. So the locally available resources, shift in policy or significant event. We're also going to talk about that. Helping clients navigate, such as dealing with addiction or abuse. Okay. So figuring out what different clients' needs are within that EBP, serving more families. We've got a lot of good discussion, I think, that we're going to have today. All right. Engagement. That's a really good one, helping people to engage in the program. And then looking at diversity, equity, inclusion. Exactly. Okay. So why adapt an EBP? Couple of reasons. Make it more engaging. We saw that in the chat. Make it more current or timely. Maybe the photos and the materials are from the late 1980s and they need a refresh, right? Great example. Fitting local constraints. Um, what is the space available? What is the funding available? And then making it more culturally relevant. How do we adapt something to make it more culturally relevant and yet retain fidelity to that program? So that'll be one of those conversations, the core of our conversation, really, that we're having today. Okay. The first thing to recognize, is that we talked about earlier is that there are two main types of adaptations. One is in content and one is in implementation. And these are some examples of what that looks like. So content, the what, is things like using local images or using local resources, adding topics that come from a socio-cultural framework. The how is actually how you implement that evidence-based practice. So thinking about making sure you have native speakers as providers of that EBP, adding more training on culture. One that comes up a lot for us in workshop is offering food during group sessions as part of the cultural basis for that program. And then one we saw over the last couple of years, obviously, is moving that EBP into a virtual setting, right? Offering it on a Zoom format or another platform. One of the key things we need to think about is adaptation is a continuum. So on one side of that continuum, we have the original evidence-based practice that can be provided at 100% fidelity. On the other side of that, you have adapted a program so much that it actually isn't that program anymore. It's a completely new program. And most programs are going to fall somewhere on that continuum, not on one side or the other, but somewhere in the middle. And we're going to talk about that space mostly in the middle today. And what we're looking at is fit, how well a program matches or is appropriate for the community, the organization, the family, and the provider. And that was one of the reasons that Jennifer opened the workshop talking about how to select an EBP. Because your first goal before you adapt an EBP is to make sure that you have the right EBP before you get started. Because if you've selected the wrong EBP for your community, organization, the families you serve, you're already in that I have to change this mode. And so good selection is really important. Start there. All right, that's my advertisement for good selection of an EBP. How can adaptations affect results? We're going to look at this throughout the rest of the workshop, but the basic and fundamental truth here is that the more you change an EBP, the less chance you have that prior results will be replicated. And changing core elements can change program outcomes. So I'm going to turn it over to Jennifer, and she's going to start talking about the how of program adaptation.
Thanks, Dana. And I'm going to take us back to dessert because that's my favorite part of every meal. So again, as Dana said, adaptation is continuum. As you can see from all these yummy pictures, we started with our cakes. We've got a chocolate cake, cookies, pancakes, pie, etc. They all have similar ingredients, but they all had different amounts, different ratios, different baking times, different pans, etc. So moving, it's a continuum. So a small change might have been taking a white cake and making it a chocolate cake by adding flavoring and different icing, etc. And then maybe cupcakes is like another step. You change the baking pan, you change the time, etc. But then you can keep going down that continuum. And the more you change things from the original recipe, the different the end result is going to be. So when we talk about fit and making that selection, it's more of know the results you're looking for before you start. So for example, in the lower right-hand corner, we have, let's say it's a lovely lemon meringue pie. If what you want is lemon meringue pie, then don't use a recipe for chocolate cake and try to adapt it to make lemon meringue pie. It's just too different. You would always start with a recipe for lemon meringue pie. And that's what we're saying here. Start with something that's the best fit for what you're trying to achieve and meets your needs, and only make small adaptations to it going forward. But adaptations are going to happen, and we know that. The developers will tell you that everything gets adapted, even a tiny bit. So how do you do that? First and foremost, use a team process. So this means don't just have one person go in and decide what you're going to change. You need to talk to your whole team, and hopefully you're involving stakeholders in your process. If you haven't, get them involved now. Stakeholders would be the people who are going to receive this, a couple of the families you'd be working with, community members. You want to involve not just leadership, but also the service providers themselves. So everyone should be involved in helping make whatever changes you decide are necessary to help this EBP or help this program fit better. Okay, so it's not a one-person approach, it needs to be a team effort. You also want to determine if you actually even need to make adaptations. You might want to try or pilot the original model exactly as it's designed and see if you're getting appropriate results. There's actually a fair amount of research that shows that the EBPs work exactly as they are. And in some cases, when they're adapted, it didn't really make any difference to the outcomes. So think about whether you want to do that first. Also, if you are going to be making adaptations, be proactive. So you want to think about them from the very beginning and decide in your team process what you're going to change and adapt so that you're not just doing it on the fly in the moment in the session as you're delivering content. Okay, so try to think ahead, looking at the materials about what will need to be adapted. And I think we're going to drop a link. If not, we'll get it to you later. I know it's in the resource document. That there's a guide from SAMHSA, the federal government, about adapting evidence-based practices. It's a really useful guide. excuse me, and it focuses on under-resourced populations. So a lot of the populations that we're working with when you're in the child welfare or adjacent system. Lastly, always make sure that you're working with the program developer or the purveyor, whoever you got this EBP from. You always want to reach out to them and talk about what you're adapting. And that's so that you don't have any unintended consequences, but also don't reinvent the wheel. The program developer is going to know, has this been adapted for use in a Native American population? Have these materials been translated or used in a Vietnamese population? They might know that, and they can save you a lot of time and also give you some valuable information about how that went. So always talk to your program developer first to see, what adaptations have previously occurred and how it went. Okay. Again, when we're adapting it, getting into the very specifics of what you do, start small. So I would say stick with smaller adaptations, and we're going to use that red, yellow, green light model, the traffic light model, in a few minutes. That'll kind of take you through what are small adaptations and what are big ones. Again, if you want to make lemon meringue pie, don't start with a cake recipe and try to adapt it. You want to start making small adaptations. And again, this is why that selection piece is so important, because if you've identified and selected a practice that almost fits your needs, you should just have to make minor tweaks. If you have a practice that really doesn't fit your needs at all, and you have to make a lot of adaptations to it, you probably need to go back to thinking about whether this was the right practice. And we'll talk about that later on too. Always document everything that you're doing. If you're just making small changes, green light changes we're going to talk about later, you can make a list. Just make sure you note down exactly what you did and why. Why did you make these changes? If you're making more complicated changes, we're going to talk about frameworks later on. And frameworks allow you to document in more detail exactly what was done and what was changed. So document everything. And I think an example of doing this is oftentimes when I'm cooking, I've got my recipe and I'll make notes like in the margin, like, increase the vanilla, or, I needed more time in baking or whatever, so that next time I use that recipe, I've already given myself some feedback. That's the documentation piece. What did you do differently? So that next time you go to do this, you've got the information about how you did it and how it worked out. Okay. No discussion of EBPs can go without talking about fidelity. So clearly, you want to be assessing fidelity even when you're adapting an EBP. And the reason is that the fidelity tools that come with practices are really looking at the essential elements. So have you changed those elements when you made your adaptations? So be sure that you are assessing fidelity. It is possible you've changed something that's on the fidelity tool, but you've talked with the program developer about it, as we said on the previous slide. And so this is coming. But if you're noticing other things in fidelity aren't hitting, you're going to want to think about whether you've unintentionally made some change to the essential elements, the core elements of this approach that's going to affect your outcomes. And then that's the last part. Anytime you adapt an EBP, be sure you're examining your outcomes. Hopefully this is a part of your entire process. What are the results you're trying to achieve? How are you measuring them? And are you getting them? And if you're not, you're going to do that, continuous quality improvement piece to go back and look at where are things going wrong? Why are we not getting the outcomes? And it might be that you have adapted something that's making a change. Could be something else, but you want to have that knowledge and that information so you can make those decisions. Okay. Right. Moving on. We often hear about the need for cultural adaptations. Please remember that culture is very broad. It's not just race, ethnicity. It could be gender identity, religion, social status, poverty, language, your experience, your context. There's so many things that fall under this. But in essence, what you're doing is adapting an intervention to meet the local needs, the community that you're serving, the families you're working with, et cetera. Okay. And as we said before, this should be a team process. So it should involve those stakeholders, that community that you're trying to adapt this intervention for, needs to be a part of the process of making those adaptations if you're going to be successful. Okay. And I'm going to walk through a couple of examples that talk about cultural adaptation. You do have some pages in your workbook. If you want to take some notes, feel free. So the first one is Affirm Youth, and this is a practice that's on the CEBC, and it's a cognitive behavioral therapy program designed for LGBTQ youth. It's a group intervention. So how this came about was that the developers realized that standard CBT really didn't address LGBTQ youth needs. So for example, one of the things of CBT might be, challenging feelings of worthlessness that someone might have. This can be really difficult for LGBTQ youth when, on social media or the news, all they're seeing is other people in society saying that actually LGBTQ people are worthless or less worthy than other people or somehow wrong. So we're acknowledging that, we have to build that culture, what the experience is to be an LGBTQ youth in today's society, into any sort of treatment intervention. And that's what they did here. What they also found is that there were very few studies on the use of CBT or standard CBT in LGBTQ populations. Not surprising. I mean, I read a lot of research studies, and very few studies, go beyond age, gender, race, ethnicity when they're reporting demographics. They don't even ask about LGBTQ status unless it's specifically targeted at that population. So what did this group do? They got together, big team process, brought in stakeholders, and they decided they were going to adapt these components of the CBT intervention they wanted to use to better reflect the needs of this LGBTQ youth population. So they built in trauma-informed principles. I think now we all are recognizing that everything we do has to be trauma-informed. When this program was being developed, it was a little bit of a newer idea. They brought in something called the minority stress framework, what it's like to be a minority in a population, how that builds on this additional stress. They added some modules that are not in the typical group CBT. They added things on hope, building hope and having hope. They added things on building social supports, because for a lot of LGBTQ youth, they don't have a lot of positive social supports. And then, of course, they modified the language to be more inclusive. So in traditional CBT, it's, coming from our heteronormative, society approach. They wanted to make sure the language in all of the materials was really more respectful and reflecting an LGBTQ population. Right. So that was their solution. What they did, and again, this was a pretty extensive adaptation. They definitely used the frameworks that we'll talk about later on, but they did pilot it. They looked at outcomes. They did a lot of feedback. So as they were piloting it, how was this going? They had, a couple advisory boards. They had community providers, all sorts of folks giving feedback. One of the things they quickly realized was that they needed to add in more training for the providers, that they could not assume that mental health providers had an extensive experience either in CBT or in the specific needs of LGBTQ youth. And so they needed to build on more training and ongoing training to keep people up to speed. Okay, so this was one example of how they adapted CBT, pretty common intervention, for a very specific population and had good success. And I know it's on the clearinghouse. And Rhonda Williams, I think you're on. If you want to drop a link to Affirm, feel free. But I'm going to go on to another example. So here's another one, something called Weaving Healthy Families. So this is another cultural adaptation of a program called Celebrating Families. Again, also on the Celebrating Families is on the CEBC. I don't think we have Weaving Healthy Families on there yet. So this was an intervention where, thank you, I see Rhonda and Haley both dropped it. Thank you very much. Where they were targeting Native American communities. And what are the challenges here? We know that when we're working with Native American families, and celebrating families, sorry, let me say that, celebrating families is a violence and substance use prevention program. We know in working with Native American families that they have a very complicated trauma history. They've experienced historical and current oppression. We do know that Indigenous groups, unfortunately, are at higher risk for mental health issues, substance use, PTSD. I mean, we're seeing higher prevalence rates there. And we also know there are very few culturally specific programs for Native American families. Unfortunately, populations are small, and it tends to be that we develop interventions that are, designed for the majority of the population and don't always get at the needs of our smaller populations, like Native American groups. So what happened here is that a group of stakeholders, in both Indigenous stakeholders and a community advisory board involving professionals, et cetera. So again, a team effort, including stakeholders, went through what are some options, what are some programs that we could use. And they selected the Celebrating Families curriculum, but they wanted to add pieces to it and make it more culturally relevant for their own populations. So they added in some pieces that dealt with the historical oppression, or at least recognized it. They added in this framework, this FHORT, Framework of Historical Oppression, Resilience, and Transcendence. And then they also utilized more of a Native technique called the 2I seeing approach. So again, they added this in to the content to make it more relevant and more culturally appropriate for their community. Okay. And I should note that Celebrating Families had already been adopted by some Indigenous communities with a cultural overlay, but not quite to this extent. So they went a little bit further, adding in content. So some of the changes that they made concretely were that, one, they ensured that the program was facilitated by tribal community health representatives. It was very important to them that the intervention be delivered by their own people. So that was a key. They also involved the entire family and even the extended family in some situations. The initial delivery system was like mom, dad, kids, or some variation thereof. But this was the whole family. You want grandma to come, you want cousins, bring them all. Everyone who's involved in this family is welcome to be part of this process. One thing they did need to do for reality's sake is to shorten and streamline the program a bit. And we'll go over specifics for that in just a second. And so there's always some questions when you shorten. What do you take out? What do you reduce? So again, work with the developer on that. And then they added those cultural components, talking circle, medicine wheel. They brought in more of their tribal pieces to make this more relevant. So here's more specifically what they did. So they decreased the number of sessions. Like I said, they went from 16 to 10. They changed the age grouping a little bit to kind of fit their local needs. And they changed the sessions a little bit. So in the traditional one, you would just have a meal for Celebrating Families. Now they brought in more tribal foods. It was more intentional. This was a tribal and Native American experience. When they did this Insights for Living piece, they did a talking circle. They brought in more Native American components, their own culture into all of these sessions. And they built in more tribal teachings throughout, as a way to foster connectivity, both with the family, which is the goal of this intervention, is to bring families stronger, but also to build the family's connection with the tribe, with their own community. So with this one, it's a little not quite as far along as that Affirm Youth. So like I said, it's not on the CEBC. A pilot study has been conducted and they had good results. It looked like it was working. And then a full trial is underway. And what they'll really be looking at is not just the outcomes. So did it have those violence and substance use prevention outcomes that we want to see, but also how acceptable was it? How satisfied were the families? Was there better engagement? Because families felt more comfortable being part of this. So they'll be looking at all of those things. So those are just two very simple examples of the ways that communities have made some pretty significant cultural adaptations to better meet the needs. So I'm going to turn it over to Dana, and she's going to introduce that traffic light model that we've been talking about. That'll help you kind of gauge the types of adaptations that you have made or are considering making. Dana?
All right. So
Oops, sorry.
oops. We're gonna mix our metaphors a little bit this morning. We're gonna keep our cake metaphor, but we're gonna add this traffic light model. And we're going to use this traffic light model to categorize examples of program adaptations. And if you're using that participant guide, and even if you don't want to use it right now, if you want to look at it later with your team, there is an infographic summary of this traffic light model on page 10. So you can refer to that now or take it and use it later. But we are going to talk about green light examples. In our cake metaphor, green light adaptations, so if you're thinking about that cake again, green light adaptations are minor changes that don't affect that core recipe. So that might be substituting vanilla extract for almond extract. Maybe you want to use a different brand of flour, or you're just going to add a sprinkle of cinnamon to frosting. Those would be green light adaptations. With EBPs, green light adaptations are safe and encouraged changes that align with the core components, remember, ingredients, methodology, equipment, of the EBP. These adaptations often involve minor modifications. And you can see some here on the slide, changing the language or format to suit the target audience or the cultural context. So an example would be modifying visual aids in a program to better resonate with a specific cultural group. Give me a quick emoji if you've worked with a program, an evidence-based program that has made one of these green light example changes or adaptations. A couple, great. Okay. These are encouraged adaptations. A few more. Awesome. Okay. So then we're going to talk about that middle part of our traffic light, the yellow light examples. Yellow light changes require really careful consideration. This is just like when you're driving and you're like, it's yellow. Do I go or not go? And you take that hesitation. That's exactly where we're at here. And really, your partner on this when you're in yellow is the EBP developer, right? It's like having a co pilot. These adaptations might involve altering components that are considered essential to the program's effectiveness. So, an example of this might be changing the frequency of sessions in a therapy program. And you can see a few others here as well. And I want to go back to that cake metaphor so you to really understand the impact of a potential yellow light adaptation. Let's say you're making a cake and you decide to use brown sugar instead of granulated sugar. You're still using sugar, but it's not the same sugar. And you are very likely to not have that consistency with your original recipe. Similarly, if you reduce baking time by a few minutes, you're probably still baking it at the same temperature, same general idea, but you reduce that baking time. Again, probably not going to get something consistent with the original recipe. So this is where if you're thinking about a yellow light adaptation, you want to work with the developer to make sure that this is something that's going to maintain that fidelity to the greatest extent possible while still getting you that additional outcome you're looking for. And then we have red light examples. Going back to that cake metaphor, a red light adaptation is like not putting in the flour or not putting in the butter, which I know for me I've done on accident a couple of times, and that's not a good scene. So imagine if a recipe calls for baking at 350 degrees. You decide you're going to speed things up by baking it at 425. The result is what? Basically a charred cake. So red light adaptations are likely to result in a completely different outcome and might compromise the cake's quality. Similarly, red light changes can significantly alter the outcome of a program, and these are strongly discouraged adaptations because they're potentially harmful to the program's effectiveness. So you can see here, these are things like shortening a program, like in my speeding up metaphor, reducing or eliminating activities that allow participants to practice skills, removing key learning activities, contradicting, competing with, or diluting the program's goals. If you're changing program goals, again, we need to go back to that. Why was this EBP selected? Is this the right EBP? So this is a completely different conversation at that point. Changing group treatment to self-directed individual treatment, Or, and this is a big one, taking a program that's designed for a certain age, like say teens, and using it with say 5 to 8 year olds, or the inverse, taking a program designed for our littles and using it with teenagers. These are red light examples. Do not proceed. Okay. So what we want to do is just a short, this is a workshop, so we're going to make you do a little work. On page 11, if you're following along in the participant guide, we have a traffic light activity. And we're going to run through a couple of examples. And so we're going to give some examples. You can answer in the chat or you can raise your hand and come off mute. But I'm going to ask if you select the correct answer, you also tell us why you selected it. So here is our first adaptation. You have updated the lesson with images that represent the culture of the community and the participants. Red, yellow, or green, and why? Green, yellow, green, green, green. Okay, somebody tell me. Looks like we've got green consensus coming in. Somebody tell me why this is green. And you can refer back to that infographic on page, was it 10 um, in your participant guide if it helps you to remember sort of what those levels are. Why would this be green? Inclusion. What's the major feature that makes this green as opposed to say yellow or red? Why is this an acceptable and encouraged change? Safely aligns with core elements. Yes, Joanne, that is exactly it. This is a minor change that actually works toward being more culturally inclusive and more representative while safely aligning with those core elements. You're not making a core change to the ingredients, the equipment, or the methods. Okay, let's try another one. These actually get a little bit harder. Number 2, you're going to replace an activity in the evidence-based practice with an activity that is more culturally relevant. What do you think? Yeah, you're on to us. Okay, yellow. But why is it yellow? What's the key here? I love that, Brittany. I've never actually seen that before. That's really cool. Why is this yellow? Again, you can put it on the chat or you can raise a hand and it'll bring you off mute. Why do you think this is yellow? So you're almost there. It's essential to program effectiveness. The key here in this example is that term replace an activity, right? So if you are swapping out an activity, it's not necessarily red, but it's not one of those like, great, let's just do it. It's green. This is that yellow area where you need to slow down and partner with the developer to make sure that you're maintaining fidelity. Let's see what else you're all saying, because you're substituting an activity. You're studying the activity to determine if it's equivalent. Essential to program. Yes, all of those things. That's great. Yep, might change the way that the program is offered. Ah, nice, Rhonda from John Ray. I love it. Jennifer, would you add anything about yellow here?
Yeah, I think you've all got it. It's just that you don't know. What's the activity you're replacing? Is this an icebreaker, or is this like a core component? So again, you've got it. You want to use caution, check with the developer so you don't make anything that's going to cause a really negative effect.
Yep. All right, let's try another one. We're going to go to number 3. And this one is you want to provide additional resources that support the strengths and needs of your participants. Red, yellow, or green. And why? And you've got space if you want to kind of remind yourself of these later. There's space in that guide to make some notes for each of these. Ooh, we've got some dissent here, some green, some yellow. What do we think this is? Let's see a few more. Sharon, green, you are still giving the core components. So in this case, you're adding resources that provide local context or data. And that's fine. That's a green light change. Yep, you're not changing the content or the delivery. So that really goes back to sort of ticking through those the core cake metaphor, right? Ingredients, equipment, methodology, those are not changing, but you're adding additional information for your local participants. So that's great. And I think we've got one more. Changing the program goals to meet local needs. Where does this fall on the traffic light and why? It sounds great, right? You're working to meet local needs. What do we think? Yes. So this is very, very red. If you are if you are looking at changing the goals of the program, you're probably looking at selecting a new program. Um, so this is where you would stop and say, we're actually not adapting this program. We need to select an EBP that fits our needs and then start that process again. And if you are in that place again, and you're in California, and Jennifer's going to mention this again, if you are in California and you're in that place where you're adapting to the point where you need to select something new, you have that selection guide that we talked about earlier, and you can contact the CBC for help. So those are a couple of great options. Awesome. So you've had some practice,
Can I
which
jump in for
means
just a second about that one? Because I
yes,
think
absolutely.
this is really an issue. Really going back to one of the first slides I presented, which was figure out what you're trying to achieve. What are your goals? Start from there in your program selection. And I think that this is where we often run into issues. And people are pointing out that, yes, in the workbook, it uses the term adjusting the program goals to match the cultural beliefs of participants. So again, we're changing the goals. Let's look at what's changing and how, and what are you doing to it? So again, you want to talk to the developer. But ultimately, the goals should always drive the program selection, not the opposite. You don't select a program and then change the goals to meet your needs, because the goals are what a program does, and you want to start with that.
Okay, exactly. Everybody's had a little bit of practice now. We are going to do a small group discussion activity. And if you're following along in that participant guide, and hopefully somebody in your group will be, but if you all are, that's fantastic. You're going to be looking at pages 12 and 13. And if you want to take a sneak peek at 14, it's also a really nice way to frame that discussion. And we'll be looking at that afterward as well. The first page has the scenarios that you can look at. In your group, decide as a group on one of those scenarios. You do not have to work through all of them. We've given some choice. Pick one. And on the next page, on page 13, are some discussion questions around that scenario. So you're going to take a minute or two, read the scenario that you as a group have selected, and then work through the questions on page 13. Again, on page 14, which we'll be looking at in the follow-up discussion, you'll see that there's some ways to organize some of those discussions you might be having. All right, so we are going to send you all to breakouts. A couple of things. It is always more pleasant in a breakout if you can be on camera. If you can't, that's okay. But it's great when there's that level of interaction. If for some reason you cannot participate in a breakout, let us know. And we'll bring you back probably in about 12-ish minutes. So you get a good amount of time where we're going to do some follow-up discussion on these. If you have any difficulty either getting to your breakout or you get there and you're by yourself, come on back and we'll make sure that you get into a lively discussion on adapting EBPs.
Also, take a minute when you get to your breakout and introduce yourselves and say hi to each other.
All right, we're going to open those now.
So we're going to do a little processing of how that went. So as I was just saying, if you are able to turn your camera on, please feel free. You can change your view so that you can see the participants, so we can kind of have that conversation. And I would love, if people are willing, I'm going to ask some questions. And if you are willing to come off mute, I'll have you raise hand and we'll kind of talk through it. So first of all, I'd love to see if any one of the groups would be willing to kind of do a report out. How did it go? What scenario did you pick? What did you discuss, etc.? Any volunteers for that? Oh, I see somebody. Is it Yadira?
Yes.
Would you be willing to do a report out for your group?
Yes. So we picked scenario number two,
Okay.
the family-based program for a community with high Mexican American population. And the focus was to reduce substance use and increase family communication skills. So we basically, the commun what we considered to be unique about the community, of course, it's the culture, the
Mhm.
language, and literacy. With this population, it's it's important to take into consideration those three things because
Yep.
it is those individuals may not be fully literate and then I would say even like the availability
Mm-hmm.
just because most do work and their time is focused on work and home and sometimes they're not as flexible. So when considering some adaptations, so one of the things we thought about was increasing literacy opportunities and translating of resources. And that one we gave it a green. Um, Trained staff or individual with lived experience to support with carrying on the program. We gave that one a green. Involve all stakeholders to see if this may be the best program to support the needs. We gave this one a yellow because overall we kind of felt like this is gonna be a possible thing that's moving forward. And then we just kind of stayed on the last one we're looking at was time flexibility, and we're
Mhm.
still considering whether it was green, yellow,
Mhm.
one of
Okay,
those two.
great. If there are other folks who also picked scenario two and you want to add anything to this, but I think Yadira, I think that was great. You guys did a really good job kind of thinking about what the needs are. So I think you hit the key points. So we've got issues of language, literacy, availability. I mean, let's just imagine you're working with like a migrant farm worker population, or, these are people who, like you said, may not be able to meet at 3 o'clock on a weekday, et cetera. So you have to kind of think about what those adaptations might be that weren't in the original plan. So what's an example of how you might, and again, Yadira, you can answer, anyone else can jump on and answer, but what's an example of how you might meet the time needs of these parents when delivering your intervention? What could you do to make it a better fit for your communities, for this population's needs?
So based on past experience with other programs that I've worked with, one of the things that we did was we whenever we had families come in and are to the resource center, we kind of gave them like a little survey
Mhm.
to see what times and dates kind of worked for them. And then oh when we started offering parent programs and trainings, we made those trainings fit those times that they
Mhm.
suggested. And we also offered childcare. And
Yep.
for some of the trainings, just depending on how much funds we had, we also offered like incentives or dinner.
Great. Yeah, I think those are perfect examples. Anyone else have other examples of how they've tried to make, parent training education fit into the time and needs constraints of their community? What else have people done? So you touched on, oh, sorry, go ahead, Patty.
I was going to just say, I think another one is looking at organizational policies and procedures to allow for flexibility of staff
Mhm.
to flex their hours to be able to accommodate the need of community. So if they have to work late one evening, they don't have to come in. They can flex their schedule to meet also their own family needs to make sure that they are not burned out.
Yep. Yeah, I think that's a perfect example. It isn't just, you have to work within the constraints of your agency and figure out what's going to fit there, but also the agency needs to consider that you're going to have to be flexible to meet the needs of the families that you're working with. Other things we've seen, I think you touched on some of the media. If it's, in the evening, offer a meal. offer childcare? Could you have, tutoring support for the kids to help get their homework done? Like, where do you host these trainings? Could they be done virtually? We've learned that virtual delivery works for many things, not everything. I don't know in this particular case, but you could think through what are some of the options. So, thank you. Let's give a nice round of applause to Gadira for being our first sharer. I appreciate that. I think we've got time for one more. So if anyone, any group that did either scenario 1 or 3 would be interested in sharing, would someone be willing to raise a hand? Lisa, you've got your hand up. I don't know if did you do 1 or 3? Oh, perfect.
We were
Go ahead.
3. Yeah, we were
Excellent.
3.
Okay.
So your organization is preparing to implement a parenting program in a very rural community. There's more information about substance misuse. The program was not tested within the rural group. And so wanting to adapt the program to better fit the parents' strengths and needs. Yeah. Even though those were the things that were really important, the things that really stood out to me, and Christina shared her program, but the things that really stood out to me was funding, as we all know, limits so much whenever we're looking at programs, and how can we fix that services to the community by changing the eligibility, even though it's not funded. And so that could put a huge constraint on a program, is that not being able to expand the program to other families because of eligibility based on the funding. And so how do we open it up? So that's not necessarily evidence-based, and how do we keep it within the evidence-based, but it is really important when we're thinking about families, and in this situation, adapting the families, and it's separated by zip code, which also can be one of those things that can be challenging. And then the other thing that was really interesting is the dosage of the program. Even though there was success with the dosage, at the end of that time, families wanted more. They didn't want it to end in that period of time. And so again, how can you, if the program is designed for a specific amount of dosage, how do you continue to work with those same families within that program? So Christina, if there's anything else you want to add, I'd love to have you add more information.
I think you covered it really well, but yeah, we definitely were talking about how, the funding can affect that. Like, it's really, I feel like it's really hard when we're implementing this program and we're so limited to what we can provide. And then with what we can provide and families wanting more, we're also limited to giving them that. So an example of that was, my program is only 6 to 8 visits, depending on the family's need or the criteria that they meet. And at the end of that program, we always do a survey and ask like how we can improve, what would be more helpful. And they're just always asking for more visits, which unfortunately we're unable to do.
Yeah. I mean, I think you hit, to me, financing, that's a key issue. And we put that right up in the selection piece. So when you're selecting an intervention, you want to look at things. How are you going to fund this? Are there multiple ways you can fund it? Because you do run into that issue that this funding stream is only for these people living in this zip code or with this issue. And then, you're like, oh, well, I can't offer it to them. So the one thing I always say is there any opportunity to blend funding or braid funding? If you've got 20 families that you want to offer this to, but only 15 of them fall into that funding group, could you find another funding source for the other 5 so that you could include them? Is there a way to do that? Not always possible. Go ahead. Sorry, Christina.
Do you mind if I add something now that you said that?
Yeah.
A way that we've actually kind of gotten around like things like that, like if there was families that were really interested in the program, but they didn't live in that targeted zip code, or they had completed their visits, is we were able to get around that by forming like what we called a group. So instead of doing home visits, we invited the families to like our site. And instead of it being a one-on-one, it was like getting this group of moms
Yeah.
together and still providing like that information and becoming more of a family resource center within that group
Bingo.
to
Yep.
be able to serve them.
Yes, I was just going to bring up family resource centers. I think that's a great place to refer families. So yes, the parenting intervention has to end. They aren't meant to go on forever, but you could look at building more of like a parent support group, and they might already exist at local family resource centers. So if you aren't familiar with the family resource centers in your area, you definitely want to get familiar. But again, like you said, you could build a group. Maybe it isn't the specific intervention anymore. Maybe you pull in pieces from other topics, but that group support model is a really great way to do it. You still have the issue of how you're going to fund it, but family resource centers oftentimes are offering things like this, and you might be able to partner with them to keep it moving. So great.
And Jennifer, just one
Mhm.
more thing also, kind of in addition to what has been said, is when we think about the programs we have,
Mhm.
our collaboration has gone from looking at a target child to serving the family as a whole.
Mhm.
And that's been a big, huge shift.
Mhm.
And also funders are still wanting to identify a target child for funding.
Yes.
They have a different expectation for visits. So we're actually trying to, ours has been a lot of data entry challenges. So how do we
Okay.
identify as parents as teachers visit? Is this a visit that meets the funder?
Mhm.
Or are we looking at that target child versus the whole family? And so that's really kind of tripped us up. Not so much that we can't do it, but that documentation of all of that has been a really big challenge for us.
Yes, I think definitely. And for those of you who are involved in your community's comprehensive prevention plan or your work for FFPS, there's different levels of how people qualify. So yes, it is definitely complicated to try to figure out how you make these services work. And so that's that upfront piece of really like, okay, before we do this, how are we going to do this? How complicated is this going to be? Some of the moves that are going on right now are to kind of change the way that billing occurs for the evidence-based practices that are in the FFPSA approved list of programs, so that you bill for that as opposed to billing for the components of it. So there are some changes hopefully coming down the road. But yes, I think that's definitely acknowledging that how you get all this stuff funded, it can be very complicated.
Yeah, and then the final thing that's kind of
Mhm.
been a challenge for us also is education level of
Yes.
those providing the home visits. So
Yes. And I think that takes you again back to that selection piece, which is, who's your audience, who's your workforce that you're going to use, and you really need to select an intervention that's appropriate for them. I work at a hospital, that's where Caltrin is based, and when I hear about models, of home visiting that require a nurse, I'm thinking that could be pretty hard in a lot of communities, because I know we barely have enough nurses where we are. Plus, it's a very different model from one that uses a parent professional or a parent partner. And so you really need to think about what's a good fit for your agency. And then, like you said, make sure you're doing enough pre-training. You're getting that training out there so that you can bring in a paraprofessional, someone who, is of the community, but is going to need a little bit more training, than someone who's coming into this with years of experience or a higher education, et cetera. So they can be just as good at the job. They're just going to need a little bit more support initially and ongoing. But you know what? Everybody needs training initially and ongoing. That's why Caltrin's here. So we're good. Okay. I'm going to thank you very much, Lisa. Let's give a round of applause for Lisa and to her group for sharing, and Christina also. Thank you. Appreciate everyone, sharing their real examples. So before we move on and talk about adaptation alternatives, I just wanted to hear, was there anyone else who wanted to share, whether it was an aha moment, a challenge, a question that you had that came up in your group, anything else you want to bring kind of to this discussion before we go on? And again, feel free to put it in chat. You can come off mute, raise hand, whatever you want to do. We'll give it a quick second. And I think that, the examples that we got were pretty good representation of what we were looking for. So, good reflection on the needs of these groups and specifically what you would change. All right. Well, then I am going to go ahead and take us on to our next piece, which really kind of reflects back to page 14 in your workbook. So, adaptation alternatives. So first question is, in any of your groups, did you come up with any changes you would want to make that you classified as red? Any red examples that came up in your brainstorming? And if you did, can you drop them in chat? So, and maybe even yellow. If there were yellows you weren't so certain about, go ahead and put those in. So I'd like to get a couple of examples of things that you came up with that were yellow or red. And then we can kind of talk through what you could do differently. Because when you're making adaptations, we've said you want to start with the smallest amount of change that's necessary to meet your needs. And so what page 14 has you do is to think about, depending on the modification that you identified, what can you change? You might also want to jot these down on page 14 in your participant guide. So take a look at page 13 and start kind of filling out page 14 with any of these. But anyone would have a yellow or a red example that you want to share with the group. All right, well, I'm going to go ahead and let's talk us through a few. So a yellow example, if you were, let's just think about kind of changes in general that we hear about, like the one that we talked about before, modifying an activity to better meet the cultural needs of your population. Oh, thank you. I just see Rhonda in the chat that it was more difficult for scenario one. You know what? Let me take a look at scenario one and see what we did. Okay. So I think you were getting at that it was a mental health intervention and did want to make changes. Okay. Yeah. That's true, but I think that's true of all models. Again, are you changing those core elements and how much do you change? All right. Sharon gave a yellow. Yellow due to using out-of-home services and in-home services. We had to ensure core components would not be changed. This is a great one. This is exactly what happened during COVID. Remember March 2020, when all of a sudden everything we did in life changed and changed very fast? We ended up taking a lot of face-to-face services, whether they were, in a clinic, whatever, and suddenly everything became virtual. So that is a change in a delivery method. If you went from one-on-one face-to-face to individual virtual, that's not as big a change because it's a one-on-one intervention. But if that one-on-one intervention was a home visit and suddenly your home visit is over Zoom, that's a pretty large change. So you really have to think about how do you minimize that change as much as possible. So some examples of that in out of home versus in home, what can you do to make that visit more like the face-to-face in-person visit? You might need to think about what kind of equipment you give to the families you're working with. Do they have a camera that they can use? Do they have a speaker, a microphone? How, if they're using their phone, for example, is there a way that you can get a headset, some way that you can help them make that, that virtual visit easier? When you're thinking about moving something that's an out-of-home service, let's say it's a group intervention to in-home, again, you've really got to think about what are the components that are changing. And when we go from group process to individual, that's again a very substantive change. So you'd want to look at and work with the developer, because oftentimes a group intervention, it's the group process, that working together, that is a core element. And so it is difficult to make those changes. So you want to think about how do you make sure that you're getting as much as you can of the original intervention in there. I would also say this goes back to selection. If you know you need to deliver something in home, then you don't select a model that was intended to be done, in a clinic setting, for example, and vice versa. So think about what you are ultimately going to need as you're selecting that program. So in general, with these, if you are thinking of cutting an activity, let's say you want to shorten the number of sessions from 16 to 10, instead of cutting all the content, could you modify it? Could you shorten pieces? Could you make sure you cover all the topics that were in those 16 sessions, maybe in a more abbreviated way? You know, what can you do to maintain as much of the original? We talked about timing. So rather than offering something, you know, in the middle of the workday, you're going to offer it in the evening, you're going to offer food, you're going to survey your families, find out when they want to meet, and adjust your schedule to meet theirs. You may need to make some changes from an administrative point of view to make that work. But you want to think about that from the beginning. If you know you're serving a highly mobile, largely, you know, Spanish speaking population, start with looking for a model that's already translated into Spanish. So make your job as an implementer, as the program side, easier by making that part of your selection criteria so that you're not having to come in and make all these major changes. So again, considering those alternatives. So as we've said before, when you're making large changes, think about using the original model first. Don't make all these huge changes. Do a pilot, see if it works. Talk about it with your stakeholder group. Do you really need this, or can you try it for one group of families, the original version? And then also, if you are looking at red, all of these changes you want to make, consider alternatives. You might need to go back to selection and rethink. You know, again, if what you wanted is lemon meringue pie, you're not going to use a chocolate cake recipe. So if you're having to make major changes, you might want to take 30 minutes and go back to the drawing board and think about what some alternatives could be. Lastly, as I kind of know I'm harping on this a little, but red should never be your first choice. If you have to make a red change or something that you think is red, you should always think about whether this is the appropriate practice. Always talk to the developer. If you have any concerns, yellow, red, anything like this, bring it to the developer. Make sure you're not changing anything that's too substantial. I would also say if you are making red level changes, you should work with an evaluator. Hopefully you've got someone who's helping you with outcomes evaluation, or you have a way that you're going to do this. But if you're going to make red changes, which is significant changes to the intervention, you really need to be looking at what are those outcomes, what are you getting, and make sure that you haven't fiddled with things too much. You also want to document what you're doing. We've said this before, but if you're making green changes, you can make, kind of a list. We changed all the pictures. We changed the wording. We translated it into the local language, whatever. But when you're making big changes, kind of the high level yellow and those red things, you probably want to use something called an implementation framework. We're not going to go into a lot of detail on these. Our EBP, the adaptation guides that are in our resource section, have some good tools. And when the CEBC documents adaptations and studies, we use something called the frame toolwork, which I'll show you in just a second. But, these are really for making major changes. They're geared at research studies. What we're talking about today are the smaller changes, the green, the yellow, the smaller things that you as agencies should be comfortable making on your own with some documentation. If you want to make changes that fit on something like this is the frame tool. And I've got a couple of my CEBC staff on here. This gets at the minutia of how and why and what you changed. So very much more complicated than you probably need for the adaptations that you're comfortable making. If you're making stuff that needs this level of documentation, definitely be working with the developer and be working with an evaluator to figure out, exactly what you've changed. Okay. So I'm going to take us on to our take-home message, but I do want to see, I don't know if we had any questions in the Q&A or if people have questions they'd like to discuss. We're hitting the end and we'll have some time. But take-home message, we'll use the food analogy again. If you want to make pie, don't start with the cake recipe. Make sure you're thinking about what's the outcome you're trying to achieve before you begin. Minor adaptations can be good. It's good to tailor an intervention to the needs of your local community if you're making those green light types of changes, the little stuff. You know, like we said, you can add flavorings to a cake. It doesn't make, it doesn't really ultimately change it. So those minor things, those cultural adaptations, but the further you go down the continuum, the more cautious you need to be. As you head towards that red end, if you're cutting things, if you are changing activities, if you are moving it from a group intervention to a one-on-one intervention, et cetera, all these things that take you further down the continuum, that's where you need to be more cautious. And that's where you really need to make sure that you're working with the developer and that you're reaching out and getting assistance on that. If you're in California, the CEBC can help with some of that assistance. I know I've talked to a couple folks, through direct message in this meeting, and said, reach out to me. I'm happy to do a quick phone call. If you're looking for a program and you can't find one, let's talk. Or if you're thinking about adaptation, or you have adapted already and you're already in process, and now you want to think about what you should do, I'm happy to just be a sounding board, even if it's just to talk for 20 minutes and then we're done. But if it can be helpful, please feel free to reach out to us. And I'm going to put up our information slides if you're not familiar with us. Again, there's our website and our email. Please feel free to reach out if you have questions. Dana, anything you want to come back in and add as we head towards our ending?
I think we have covered all of the basics, but again, we do have a little time here. And so if you have questions that are specific to a program that you are working on, or have questions about adapting, we've got some time and we can certainly get into some program specific questions if people have them. And then I also, while people are thinking about that, want to remind people that the recording will be available and the note-taking slides and the participant guide are meant to be shared. So if there's something in that guide that you're like, oh, I'd love to share that infographic with the community team I'm working on while we're looking at EBPs, absolutely. Share the materials. That is what they are there for.
Right. And actually, Dana, that's a really good point, because that goes for all the materials that Caltrin puts out. Recordings, they're on our website. You can share them. Materials that are on the website, you can use. You can use them in a staff meeting. You can forward them to people. It's fine. On the website, you can use it. It's all free. The state paid for it. Well, your tax dollars at work, I guess, paid for it. So. All right. I'm not seeing any questions come in, so I don't want to keep people over. Dana, anything else we need to cover before we wrap up?
We've got a couple of things just to mention before we close. One is that there is a survey in the chat now. At the end of that survey is the certificate of attendance. If you don't have a lot of time to fill that out, it will also be in the follow-up email, which will arrive with all of the links to the participant guide, the note-taking slide, the recordings, everything we looked at today. And then I just want to remind everybody to watch their inboxes for the next issue of Caltrin Connect coming up mid-month. We have a lot of training coming up at Caltrin. So make sure that you yourself are registering for some professional development and that you're forwarding that on to colleagues as well to give them that same opportunity. All right. So again, survey and certificate in the chat. We'll be here for a few more minutes. Feel free to ask more questions. And once you've started that survey, you don't need to stay in Zoom. It will still remain open once you've started writing. So don't feel like you need to hang on to that link. You can keep going in the evaluation once you've got it open. We were delighted to have everyone today. It was great to see such an amazing turnout for a discussion around adapting evidence-based practices. And we really hope to see you again soon for another Caltrin training. Thanks, everyone.